is one thing that you wish the general public would know about your specialty in healthcare, but they don't?
I think this will be a part one. If you're in the ICU and you ask for a warm blanket for your family member and the nurse leaves and says she will be right back and she's not right back with that warm blanket, and you hear overhead code blue, and then you decide to find out what the code blue is about, so you walk out and you go to the room that all the people are surrounded and you see your nurse in the room and you stare at her and you point at her and you say, "You didn't bring me my warm blanket," while she's performing CPR, you're going to be asked to leave. We're taught in nursing school that life comes above all else, including your warm blanket. So you will be waiting for your warm blanket.
What is one thing that you wish the general public would know about your specialty in healthcare, but they don't?
Part 4. If you're choosing to let your loved one go and we're offering medications such as morphine to make the process easier, we are not killing them quicker. There is something called a death rattle. This noise happens at their last stages of life. It is when they are attempting to breathe, but they are unable to swallow the saliva that's building up in the back of their throat. A death rattle is a for sure sign that your loved one is probably going to pass soon, usually within 24 hours. It is not a pleasant sound, and I beg you to do some research or talk to your doctor when you're thinking of putting a loved one on palliative care and letting them go peacefully. Here's a quick and easy tip that took me way too long to learn as a new grad. I'm going to show you how to get air out of your tubing, specifically your blood products. Take the tubing out of the pump, get your syringe ready, and place it on the most distal port from the air. Next, you're going to clamp the blood closed and open the saline clamp. Make sure the rest of your clamps are open so that you're able to pull the air out. This part is important. Make sure you pinch the tubing beneath the port so that when you pull the syringe, you're pulling saline from the bag instead of blood from your patient. Notice how I'm collecting all of the air bubbles inside of my syringe. Essentially, I'm priming the line with the saline now. I like to do this rather than undoing it from the patient and letting it run into the trash until all the air is out. There's multiple ways to do this, but in case you didn't know,
we're actually killing our own profession.
The other day at work, one of the more senior nurses on our floor got a nursing student. This nurse is known for being a bully. This nurse is also known for being very smart. I was worried for this nursing student because I know how this nurse can interact with other people who she thinks are beneath her. She constantly belittles people, loves making other nurses feel dumb. There was even one nurse that was going to come and help her prone her patient, and she told her that she doesn't know what she's doing since she wasn't a nurse during COVID, so she didn't need her help. I also witnessed her pull this nursing student into the break room and tell him everything he was doing wrong during his shift. I realized right away that I needed to grab him alone and tell him he was doing a great job and to ignore anything personal she said to him. One of my coworkers overheard me and ended up saying, "Yeah, but you know, the great thing about it is one day he'll look back and realize that this was such a great teaching moment because she's such a good nurse." No. That is the type of excuses we keep giving these people on our units, that just because they're smart, they're allowed to belittle people because they're gonna be a better nurse because of it. That makes absolutely zero sense to me. I also told this coworker that is the exact shit we should stop saying. And that as someone that suffers with anxiety, depression, PTSD, all kinds of mental health issues, if someone talked to me the way she talks to her nursing students and expects me to learn a damn thing that comes out of their mouth, it's not gonna work. Because if you're belittling me, my fight or flight response is initiated immediately. It doesn't matter how good of a teacher you think you are or how smart you think you are. If you're being mean to me, I will not absorb any information you are teaching me. I don't understand how some people can't kindly teach others. It is not a hard concept. What is a hard concept is constantly sticking up for these nurse bullies on the unit and allowing them to act that way. Administration and management allows them to act this way, and they never get in trouble. And then at the end of the day, they wonder, why is there such a big nursing shortage?
Okay, so good news, you are going to get to go home today. Let me get the paperwork ready, get my other patients settled. It will probably be a few hours, but you are going home today. Okay, I'll go ahead and call my wife to come get me. You can go ahead and have your wife know that you're leaving today, but I would remind her that it will be a few hours, so if she comes now, she will be waiting until I'm fully finished with everything. Okay, no problem. Hi, can I help you? Hi, yeah, we're ready to go. Thank you for coming to pick up the patient. However, I did explain to him beforehand that it would be a few hours before he would be ready to go. He told me that he was leaving today. Yes, he will be leaving today. However, it will be a few hours until I get all the paperwork finished and everything finished with my other patients first. Why don't you just do all of his stuff first so we can get out of your hair? So it is 8:30 a.m. I haven't finished giving my other patients their medications, which is a priority. And while I would love to get you out of here in a timely manner, I'm waiting on the doctor to finish writing the prescriptions as well, and I can't finish the paperwork until that's done. Okay, well, can you go ahead and take out his IVs? I would love to take out his IVs, but I am going to wait until I have the paperwork ready in case of an emergency. Okay, carry on. Thank you. Yes, what can I help you with? We're still waiting to leave? Right. It is 9 a.m. now. If I can get finished with my other patient's medication, get the documentation ready without being interrupted, it will be so much quicker. So what time? Again, I do not have an exact time, but I am working as fast as I can. I assure you. You shouldn't have told him that I could come up here. Okay, I have the documentations. I just need your signature here, and then I will take the IVs out and you'll be ready to go. Took you long enough. 10 a.m., okay. If you would let me finish my job, maybe I would have been here much quicker. Good morning, my name's Lindsay. I'll be your nurse today. I'm going to be getting some medications ready and be prepping for the morning, so if you have any questions, just ask. Where's the doctor? I'm not sure where the doctor is right at this moment, but they normally round around 9 and noon. This is an emergency. I need to talk to him. Oh, is it about the patient? Who else would it be about? Well, from my point of view, it doesn't seem to be an emergency. What's the nature of the question? You're not going to know the answer. What's the question? I just want to know if they can have ice water. Oh, okay, actually I can answer that for you. Since we're still waiting on the CT results for the stroke, yeah, I know, but they're thirsty. Oh, okay, well, I could do some oral swabs for now, but we're not going to be able to do water because the patient is at high risk for aspiration. Oh, my God. Did you hear that, Papa? You can't have water because the nurse is being mean. Good morning, I'm the doctor. Just coming in to check and see how everything's going. Do you have any questions? Actually, I do have a question. My papa is extremely thirsty right now, and the nurse is not allowing him to have water. Is he not allowed to have water? Since we are ruling out a stroke at this time, we're not going to be able to give water because the patient can aspirate. Oh, okay, that makes so much sense. Thank you so much for explaining that. Good morning, my name is Lindsay. I'll be your nurse today. If you have any questions, just let me know. Hi, Lindsay. My name's Cecilia. I'm a nurse, too. Oh, awesome. Nice to meet you, Cecilia. So what are you doing? Just getting the morning medications ready. Oh, what are they? I'll go through each of them as soon as I get them ready. Okay, I just want to know, what they are. Well, the patient has about 34 meds this morning, so as soon as I get done scanning them, I'll go through each one with you. Okay. Okay, so I just got done scanning. I'm just going to go through the list. If you notice one that you don't really recognize or you have a question about, just stop me and I'll go through it with you. Great. Acetaminophen. Aceta what? What is that? Okay, Miss Martha, I've got your pills ready. Oh, can you go over those with us real quick before she takes them? Sure, I'm happy to go over them with you, but we're just restarting her home medications. Well, I don't see the blue pill. Where's the blue pill? What was the blue pill called? Starts with a Z or something. If you're talking about the Zoloft? Yes, the Zoloft. There's a blue pill missing. So I actually have Zoloft in there. She still is getting the correct milligrams, but there's two, these are the Zoloft, the two white pills. And it equals the amount of the blue pill. No, because she only takes one blue pill. Then you have two white pills. Right, but it's the same milligrams. So the blue pill is 50 milligrams. These are each 25 milligrams. So 25 plus 25, that's 50 milligrams. So she's still getting the same amount of milligrams that she normally gets at home. We just don't carry the 50 milligram. but the one she takes at home is blue. How do I know that this is the same thing? Hi. Hi, how can I help you? Are you the nurse for my papa? Actually, yes, I am. How can I help you? I mean, I haven't seen anyone all day, so I was just curious if you were the nurse. Oh, okay. I've been his nurse today. When did you get here? Probably about 2:30. It's 2:32. Okay. What can I help you with? I was just curious if anyone's gonna check on my papa while I'm here. I mean, he's in the ICU.